Welcome to the deep dive. We're diving into dengue fever today.
Ooh, dengue.
Yeah, you sent over a ton of research and articles on dengue, so we're going to take a deep dive into it all.
Yeah.
And try to extract like the key insights
Yeah.
to help you become a dengue
Ugh.
expert without having to like read all the technical stuff yourself.
It's interesting how dengue kind of flies under the radar for how many people it infects every year.
Yeah, it's like a silent global threat,
Right.
infecting hundreds of millions annually,
Uh-huh.
and yet so many people have never even heard of it.
Yeah.
So let's start with the basics.
Okay.
What exactly is dengue fever?
Well, dengue fever is a viral illness,
Okay.
and it's transmitted primarily through the bite of infected mosquitoes.
Mosquitoes, okay.
Aedes aegypti mosquitoes, specifically.
Got it. Aedes aegypti.
Yeah. And you mostly find dengue in tropical and subtropical regions around the world.
Oh, so would these mosquitoes like to hang out?
Exactly. They thrive in those environments.
Okay, and those mosquitoes are kind of picky biters, aren't they?
They are, yeah.
I was reading, they have like preferences for who they bite,
Yeah, that's true.
like certain scents and stuff.
One of the things that draws them in is scent.
Scent.
Yeah, certain compounds in our sweat and skin oils
Interesting.
act like beacons attracting these mosquitoes.
Ah, okay.
And there's even research that suggests a connection between our genes
Our genes.
and the specific blend of chemicals we emit.
So some people are just like genetically predisposed to be mosquito magnets.
It seems that way, yeah.
That's fascinating and terrifying at the same time.
I know, right?
Like, no wonder some people are always covered in bites
Yeah.
and other people escape totally unscathed.
Right.
So let's say one of these discerning mosquitoes bites someone
Okay.
and they transmit the dengue virus.
Yeah.
What happens then?
Well, dengue is known for its pretty sudden onset.
Oh, okay.
Typically starts with a high fever,
Fever. Okay.
often exceeding 103 degrees Fahrenheit.
Wow. 103.
And that's usually accompanied by a severe headache,
Headache. Yeah.
particularly behind the eyes.
Oh, behind the eye.
Yeah, and intense muscle and joint pain.
Muscle and joint pain. Wow.
So intense that it's actually earned the nickname breakbone fever.
Breakbone fever. Oh my gosh.
And then there's a distinctive rash
a rash too?
that
Yeah.
can appear in two stages.
Two stages. Okay.
Yeah.
Breakbone fever. That's a pretty vivid description.
Right.
And kind of unpleasant.
Definitely not fun.
It sounds like way more than just like a flu or something.
Yeah, it can be pretty debilitating.
And you mentioned there are 4 different types of dengue virus.
Yes, there are 4 distinct serotypes.
4. Okay.
And this is where things get a little complicated.
Oh, no.
Let's say you get infected with one serotype.
Okay.
Your body develops antibodies against it.
So you're immune.
Right, granting you lifelong immunity to that specific type.
Okay, that's good.
But those antibodies don't protect you against the other 3 serotypes.
The other 3. So you could potentially get dengue like up to 4 times.
Unfortunately, yes.
Oh, God.
And to make it even trickier,
Oh, no.
if you get a second dengue infection with a different serotype,
Okay.
your pre-existing antibodies can actually enhance the severity of the illness.
What? So it makes it worse?
Yeah, it's almost like your immune system is working against you.
That's
It's
crazy.
just a bit of a paradox.
So getting dengue once doesn't mean you're off the hook.
Nope,
It could actually make a subsequent infection worse.
it's possible.
Now, I know we've talked about some of the symptoms, but can we delve a little deeper
Sure,
into how dengue actually, like, impacts the body?
of course.
Like, what's going on at a physiological level?
Well, one of the hallmarks of severe dengue
Okay.
is what we call plasma leakage.
Plasma leakage, what's that?
Plasma is the fluid component of your blood.
Oh, okay.
And during a severe dengue infection,
Yeah.
the virus can actually cause the walls of your blood vessels to become leaky,
Leaky, oh no.
allowing plasma to seep out into the surrounding tissues.
So it's not just the virus, like, directly attacking cells.
Right.
It's also this leakage
Exactly.
that can lead to further complications.
Yeah, this plasma leakage can lead to a drop in blood pressure,
Oh, cool.
which can be life-threatening.
Wow.
It can also damage organs
Damaged organs.
and potentially even lead to shock.
That's scary stuff.
Can be, yeah.
So if someone suspects they have dengue,
Uh-huh.
what should they do?
Well, the first step is to see a doctor.
See a doctor, okay.
They'll take your history.
Like travel history and stuff.
Exactly. Travel history, symptoms,
Okay,
any potential exposure to mosquitoes.
got it.
And then they'll likely order some laboratory tests
Okay.
to confirm the presence of the dengue virus.
And are there different types of tests?
Yes, there are a few different tests available. but
Right.
one is considered the gold standard.
Oh, the gold standard. Okay.
It's called the ELISA test,
Elisa. Okay.
which stands for Enzyme-Linked Immunosorbent Assay.
Okay.
This test detects specific antibodies and antigens
Okay.
related to the dengue virus in your blood.
In your blood. Okay.
It's very accurate in differentiating between primary and secondary infections.
Okay.
And it can even identify which serotype of the virus is causing the illness.
Wow, that's very specific.
Yeah, it's a really helpful tool for doctors.
That's impressive.
Yeah, it helps them navigate the complexities of this disease.
So once someone is diagnosed with dengue,
Uh-huh.
what happens next?
Well, the good news is that most dengue cases are mild
Okay, that's good.
and can be effectively managed at home.
At home. Okay.
With rest, hydration,
Right.
and over-the-counter pain relievers like paracetamol.
Oh, like Tylenol?
Right, to manage fever and discomfort.
Okay, that's reassuring.
Yeah, most people recover without any serious complications.
But what about those more severe cases?
Yeah.
What happens when those complications arise?
Well, if someone develops warning signs,
Warning signs like what?
things like persistent vomiting,
Okay.
severe abdominal pain,
Abdominal pain. Got it.
bleeding, or difficulty breathing,
Oh, wow.
they'll need to
Yeah.
be hospitalized.
Hospitalized. Okay.
Treatment for severe dengue usually involves intravenous fluids
Fahy fluids.
to combat dehydration and maintain blood pressure,
Okay.
as well as close monitoring for any signs of organ damage or shock.
So it sounds like early detection
Yeah,
and recognizing those warning signs
Mm.
are absolutely crucial.
absolutely. It can make all the difference in outcomes.
And I know there are a lot of misconceptions floating around about dengue treatment.
Oh, yeah, definitely.
Like I read that some people mistakenly believe that antibiotics are effective.
Right, that's a common one.
Can you shed some light on why that's not the case?
Sure, dengue is caused by a virus,
A virus. Okay.
not bacteria.
Right.
Antibiotics are only effective against bacterial infections,
Got it.
so they won't help at all in treating dengue.
They won't do anything.
Nope. In fact, taking antibiotics unnecessarily can be harmful.
Harmful. How so?
They can disrupt the balance of your gut microbiome.
Oh, the gut microbiome.
And potentially lead to antibiotic resistance,
Antibiotic resistance, right?
which is a growing problem.
Yeah, it's a big concern.
So, no antibiotics for dengue.
Okay, no antibiotics.
Definitely not.
And I've also heard that some people think steroids are helpful.
Yeah, that's another misconception.
But I understand that's not true either.
It's not. Steroids can actually suppress the immune system,
Suppress the immune system.
which can be detrimental in fighting off a viral infection like dengue.
So it would actually make it worse.
Potentially, yeah.
Okay, so no antibiotics, no steroids.
Right?
Now, what about platelet transfusions?
Platelet transfusions.
Yeah, I know those are sometimes given to dengue patients.
Yeah,
But I've read that there's some debate surrounding their effectiveness.
there is, yeah.
Can you clarify when they might be necessary
Sure.
and when they're not?
Platelet transfusions are not routinely recommended for dengue patients.
Okay.
They're only considered in very specific cases
Oh, okay.
where there's significant bleeding
Bleeding, okay.
and a critically low platelet count,
Got it.
often focusing on managing the patient's overall condition rather than solely relying on platelet counts
Okay.
leads to better outcomes.
That makes sense.
Yeah, it's a more holistic approach.
It seems like there's a lot of nuance when it comes to dengue treatment.
There it is.
And it's really crucial for healthcare providers to be well informed
Absolutely.
about the most effective and appropriate interventions.
They need to stay up to date on the latest research.
Right. And the best practices.
Exactly.
Well, we've covered a lot of ground already,
We have.
from the basics of dengue
Yeah.
to the complexities of its diagnosis and treatment,
Mm-hmm.
but there's still so much more to explore.
Definitely.
Let's move on to some of the other facets of this disease,
Okay.
like the potential complications it can cause and how it can sometimes be confused with other illnesses.
Right. It can be a bit of a chameleon.
Oh, interesting. Okay.
Dengue can definitely throw some curveballs.
Okay. I'm ready for the challenge.
Great. Let's dive in. Dengue can be a real chameleon when it comes to symptoms.
Oh, so it can be hard to diagnose.
Yeah, it can be tricky sometimes.
Okay.
It often gets confused with other diseases.
Oh, I see. So it's like a medical detective story
Right. Trying to piece together the clues.
to figure out what's really going on.
Exactly.
So what are some of the diseases that dengue gets mistaken for?
Well, one of the usual suspects is leptospirosis.
Leptospirosis.
It's a bacterial infection.
Okay.
Spread through contact with animal urine.
Animal urine.
Yeah, often found in contaminated water.
Like after a flood or something.
Exactly, or in areas with poor sanitation.
So it's not just about mosquito bites then?
Right. Contact with contaminated water can be a risk factor too.
Okay. And how is leptospirosis similar to dengue?
The symptoms can be very similar.
Okay.
Fever, muscle aches, headache.
Yeah, those are all dengue symptoms too.
Exactly. It can be quite deceptive.
So how do doctors tell the difference?
They'll look at the patient's history.
Like their travel history and stuff?
Yeah, and any potential exposures.
Okay.
And importantly, they'll do specific blood tests.
Blood tests to check for the bacteria.
Right, to detect antibodies against leptospirobacteria.
So it's not just about treating the symptoms.
No,
It's about understanding the root cause.
absolutely. To ensure the right treatment is given.
That makes sense.
Accurate diagnosis is key.
And what about malaria?
Malaria.
Yeah, that's another one spread through mosquito bites, right?
It is, but a different type of mosquito.
Okay.
Not the Aedes aegypti that transmits dengue.
So different mosquito, but similar symptoms.
Right. Malaria can also present with fever, chills,
Okay.
headache, muscle pain.
So again, it comes down to the patient's history and blood tests.
Exactly. Those are crucial for differentiating between the two.
Got it.
Malaria can be more serious, though.
More serious, in what way?
It can lead to more severe anemia
Okay.
and organ damage,
Organ damage, wow.
especially impacting the spleen.
The spleen, okay.
So it's important to catch it early.
Right, early detection is key.
Definitely.
And then there's chikungunya.
Chikungunya, yeah, another tricky one.
That one's a mouthful.
It is.
So how is chikungunya different from dengue?
Well, it shares some common symptoms.
Like what?
Fever, joint pain, rash.
Okay, those are all dengue symptoms too.
Right, but the joint pain with chikungunya,
Yeah.
it tends to be much more persistent
Persistent? Oh no.
and debilitating.
So it lasts longer.
Much longer, it can linger for weeks, months, even years in some cases.
Wow, that sounds awful.
It can be quite debilitating.
So with all these diseases mimicking dengue, it seems like getting the right diagnosis is crucial.
Absolutely, it's the foundation of effective management.
Okay, so we've talked about dengue mimicking other diseases,
Right.
but are there any complications specific to dengue itself?
Yeah, dengue can definitely throw some curveballs.
Like what?
One potential complication is organ dysfunction.
Organ dysfunction, what does that mean?
It means that organs like the liver, kidneys, and circulatory system can be affected.
Oh, wow, so the virus can damage those organs.
In severe cases, yes.
How does that happen?
It's a combination of factors.
Okay.
Sometimes the virus directly attacks the cells,
Oh, I see.
and other times it's an overactive immune response that causes damage.
So the body is kind of attacking itself.
In a way, yes, it's like friendly fire.
That's scary.
It can be, yeah.
Are there any other complications we should be aware of?
Yeah, bleeding disorders are another serious concern.
Bleeding disorders, okay.
Dengue can interfere with the blood's ability to clot properly.
Oh no, so you could bleed more easily.
That's right, it can lead to internal or external bleeding.
That sounds terrifying.
It can be very serious.
What are some signs of bleeding that people should look out for?
Things like bleeding gums, nosebleeds,
Okay.
blood in the vomit, or stool. Easy bruising can also be a red flag.
So if you notice any of those things,
Yeah.
you should seek medical attention right away.
Absolutely. Early intervention is crucial in those cases.
Okay, so we've got organ damage, bleeding disorders, anything else?
Yes, there's also the risk of secondary infections.
Secondary infections, what are those?
When your immune system is busy fighting dengue,
Yeah.
it's more vulnerable to other infections.
Oh, so it's like a double whammy.
Exactly. You're dealing with dengue,
Uh-huh.
and then potentially another infection on top of that.
That's rough.
It can be, yeah.
So it's important to be extra careful during recovery,
Definitely. Good hygiene practices are essential.
like washing your hands a lot.
Right. Frequent hand washing.
Okay.
Avoiding contact with sick people.
Right, all those things we've been hearing so much about lately.
Exactly. They're more important than ever.
Good reminders.
It's always good to be cautious.
Well, we've learned that early recognition and prompt medical attention
Yeah.
are critical when it comes to dengue.
Absolutely.
Are there any specific clinical pearls or key takeaways
Cytical pearls, yeah.
that you think healthcare providers should keep in mind?
Definitely. One of the most important is serial clinical monitoring.
Serial clinical monitoring, what does that mean?
It means closely tracking a patient's vital signs,
Okay,
their fluid status, and overall clinical condition.
so it's not just a one-time checkup.
Right. Dengue can be unpredictable.
Okay,
A patient's status can change rapidly.
I see. So you need to keep a close eye on them,
Exactly. We need to be vigilant.
looking for any subtle changes.
Right. That might indicate a turn for the worse.
Okay, and you mentioned hematocrit levels.
Yeah, hematocrit levels are another important factor to monitor.
Can you remind us what hematocrit levels are?
Sure, hematocrit refers to the percentage of red blood cells in the blood.
Red blood cells. Okay.
Basically, it's a measure of how concentrated the blood is.
Okay.
In dengue, hematocrit levels can climb
Climb. Why is that?
because of that plasma leakage we talked about.
Oh, right. The plasma is leaking out.
Exactly, so the remaining blood becomes more concentrated.
I see. So a rising hematocrit level could be a sign that things are getting worse.
Exactly, it's a red flag.
A red flag. Okay.
That warrants closer monitoring.
And potential intervention.
Potentially, yes.
Okay. So we've got serial monitoring, hematocrit levels. Any other pearls of wisdom to share?
Yes. Another key pearl is avoiding unnecessary interventions.
Unnecessary interventions like what?
Well, we talked about how antibiotics are ineffective against dengue.
Right. They don't work on viruses.
Exactly, so those should be off the table.
Okay. No antibiotics.
And platelet transfusions,
Yeah.
as we discussed, are rarely necessary.
Right. Only in specific cases.
Exactly. So it's about using those resources judiciously.
Making sure that every intervention is truly beneficial.
Precisely.
Evidence-based medicine is key.
Absolutely. That's our guiding principle.
It sounds like staying informed and being proactive
Yeah.
is really the best defense against dengue. But what about preventing this disease in the first place?
Prevention.
Yeah, what measures can we take to protect ourselves and our communities?
Well, the most effective way to prevent dengue
Okay.
is to eliminate mosquito breeding sites.
Mosquito breeding sites. Okay.
Remember we talked about how the Aedes aegypti mosquito
Yeah.
has a rather limited flight range?
Right. They don't travel very far.
Exactly. Their flight range is only about 400 meters.
Wow, that's not very far.
So the mosquitoes biting, you are likely breeding very close by
Oh, interesting.
in your immediate surroundings.
So it's not just about what's happening on a national level.
Right.
It's about what we do in our own backyards,
Yeah, exactly.
in neighborhoods.
Simple actions like emptying containers that collect water.
Like what kind of containers?
Flower pots, buckets, old tires
Okay.
can make a big difference.
Oh, I see. Get rid of any standing water.
Right, and keeping your gutters clean and free of debris is crucial too.
Okay, good tips.
Basically, anywhere water can pool is a potential breeding ground for these mosquitoes.
So it's a community effort.
It is. Everyone needs to do their part.
And public health initiatives are important too, right?
Absolutely. Things like organized vector control programs,
Okay.
public education campaigns.
To raise awareness about dengue.
Right, and mosquito prevention,
Oh, yeah.
and early case detection and management.
So it's a team effort.
It is. We all need to work together to combat this disease.
And speaking of teamwork,
Uh-huh.
I know there's been a lot of research and development
Yeah.
focusing on a dengue vaccine.
Right. There is a vaccine called Dengvaxia,
Dengvaxia, okay.
but it's not recommended for everyone.
Oh, why not?
It's primarily indicated for individuals who have already had a dengue infection.
So if you've never had dengue,
Yeah.
you shouldn't get the vaccine.
It's not recommended.
That seems counterintuitive.
I know. It's a bit unusual.
Why is that?
Because the vaccine can actually increase the risk of severe dengue.
Increase the risk.
Yeah, in people who have never been infected before.
Oh, wow. That's something to keep in mind.
Definitely, it's important to talk to your doctor.
To see if the vaccine is right for you.
Exactly. Vaccination decisions should always be made in consultation with a healthcare professional.
Okay, good advice.
It's always best to err on the side of caution.
Well, it sounds like there's a lot of ongoing work
There is.
to tackle dengue.
Yeah, it's a global effort.
But are there any other promising avenues being explored?
Oh, definitely.
Like any new research or developments on the horizon?
Yeah, scientists are constantly working on new solutions.
Okay, that's good to hear.
They're exploring different vaccine platforms,
Vaccine platforms, what are those?
different ways of making vaccines,
Oh,
live attenuated vaccines,
okay.
inactivated vaccines,
Got it.
and even DNA vaccines.
DNA vaccines, that sounds futuristic.
It is cutting-edge technology.
So the goal is to find a vaccine that's safe and effective for everyone.
Exactly, regardless of prior exposure.
That would be amazing.
It would be a game changer.
And what about new treatments?
There's research into new antiviral
Antiviral drugs, okay.
that could potentially target the dengue virus directly.
So instead of just treating the symptoms,
Right.
you could actually attack the virus itself.
Exactly. That's the idea.
That would be incredible.
It would be a major breakthrough.
So while there's no cure for dengue yet,
Not yet.
there's hope on the horizon.
Definitely, the scientific community is making progress.
That's encouraging to hear.
It's an exciting time for dengue research.
But let's not forget, the impact this disease has on a broader scale.
Yeah.
What about the economic consequences of dengue?
Yeah, dengue outbreaks can be very costly.
Costly in what way?
They strain healthcare resources.
Right.
We see increased hospital admissions.
More people getting sick.
Exactly, longer hospital stays.
Okay.
And of course, higher medical costs.
So it's a burden on the healthcare system.
Definitely.
And those are just the direct costs, right?
Right, there are indirect costs too.
Like what?
Well, dengue can lead to lost productivity.
Lost productivity. How so?
People are too sick to work
Oh, right.
or care for their families.
Okay.
Businesses are impacted.
Yeah, it can disrupt the whole economy.
It can, and don't forget the impact on tourism.
Tourism, right? People might be afraid to travel to affected areas.
Exactly. Dengue outbreaks can deter travelers,
Okay.
leading to significant revenue losses for the tourism industry.
So the economic ripple effect is quite significant.
It is. It impacts individuals, families, businesses, and entire countries.
So dengue is not just a health problem.
No.
It's an economic problem, too.
Absolutely. It's a multifaceted issue.
Okay, we've touched on some of the challenges dengue presents.
Uh-huh.
But what does the future hold for this disease?
That's a good question.
What trends are we seeing in dengue epidemiology?
Well, one trend that's raising concerns
Okay.
is the expanding geographical reach of dengue.
Expanded geographical reach, you mean it's showing up in new places?
Exactly. It's spreading to new areas.
What's driving this expansion?
It's a complex interplay of factors.
Okay.
Climate change is playing a role.
Climate change, how so?
Warmer temperatures and increased rainfall
Okay.
create more favorable conditions for mosquito breeding.
Oh, I see. So the mosquitoes can survive in more places.
Right, they can inhabit new territories.
And that expands the areas where dengue is endemic.
Exactly.
So the map of dengue risk is literally changing before our eyes.
It is. It's a dynamic situation.
But we're also seeing more frequent and intense dengue outbreaks
Yeah, that's another trend.
in areas where it's already established.
Right, the outbreaks are becoming more severe.
Are there any specific factors contributing to that?
Several factors are at play.
Like what?
Urbanization, population growth, global travel,
Okay.
all contribute to the spread.
So as our world becomes more interconnected,
Uh-huh.
so do the challenges we face.
It's true. Global health issues require global solutions.
And there's another factor complicating things further.
Oh, yeah.
Insecticide resistance.
Insecticide resistance, right?
You mean the mosquitoes are becoming immune to the chemicals we use to control them?
Unfortunately, yes.
Oh, no.
The overuse and misuse of insecticides
Yeah.
have led to the emergence of resistant mosquito populations.
So they're evolving,
They are. It's natural selection at work.
and that makes it harder to control their spread.
It does. It's a constant battle to stay ahead of the curve.
So we need new strategies.
Definitely. We need to be innovative.
What about mosquito control? Are there any new approaches being explored?
Absolutely. There's a lot of exciting research happening in this area.
Oh, like what?
One promising area is the development of sophisticated mosquito traps
Mosquito traps, okay.
that take advantage of the insect's attraction to certain scents and colors.
So instead of spraying insecticides everywhere,
Right.
you can lure the mosquitoes to a specific location and trap them.
Exactly. It's a more targeted approach.
That's smart.
And then there's the groundbreaking research into genetic modification of mosquitoes.
Genetic modification. Wow, that sounds straight out of a science fiction movie.
I know, it's pretty amazing.
What does that involve?
Well, scientists are exploring ways to genetically modify mosquitoes
Okay.
to make them resistant to the dengue virus.
Resistant to the virus, so they can't transmit it.
Exactly. Imagine a population of mosquitoes
Yeah,
that simply can't spread the disease.
that would be incredible.
It would be a game changer.
What about controlling the mosquito population itself through genetic modification?
That's another avenue of research.
Okay.
They're looking at ways to reduce the mosquito population
How would they do that?
by limiting their ability to reproduce.
Okay.
For example, introducing genetically modified mosquitoes
Okay.
that produce offspring unable to survive or reproduce.
Oh, I see. So you're kind of like breaking the cycle.
Exactly, reducing the overall population over time.
Those possibilities sound exciting.
They do.
But I imagine there are some ethical and ecological considerations.
Absolutely. We need to be very careful with genetic modification.
Right. Make sure there are no unintended consequences.
Exactly. We need to proceed with caution.
And consider the broader ecological context.
Definitely. We don't want to disrupt the balance of nature.
Well, we've covered so much ground in this deep dive.
We have.
The intricacies of the dengue virus,
Yeah.
the complexities of diagnosis and treatment,
Uh-huh.
the importance of prevention,
Right.
and the ongoing research that's shaping the future of dengue control.
It's been a comprehensive overview.
It's been a truly insightful journey,
I agree.
and I think it highlights
Yeah.
just how complex and multifaceted this disease really is.
Dengue is definitely a formidable opponent.
It is, but it's encouraging to see
Yeah.
that so many brilliant minds
Yeah.
are dedicated to fighting it.
Absolutely. The scientific community is working tirelessly.
Now, before we move on to our final thoughts,
Okay.
I want to take a moment to acknowledge the healthcare professionals on the front lines of this battle.
Yes, absolutely. They deserve all the recognition.
Doctors, nurses, lab technicians, public health officials,
They're the true heroes.
they're the ones diagnosing and treating patients,
Right.
providing supportive care,
Mm-hmm.
and implementing those crucial prevention control measures we discussed.
They're making a real difference out there.
They're truly on the front lines,
Yeah.
and their dedication is essential.
Couldn't agree more.
Speaking of the front lines,
Yeah.
I'm curious about one thing you mentioned earlier.
Yeah.
The concept of clinical pearls.
Oh, yeah. Clinical pearls.
Can you elaborate on what those are?
Sure. Clinical pearls are like insightful observations
Okay.
and practical tips
Practical tips, okay.
that come from experience
Experience, okay.
and deep knowledge of a particular disease.
I see, so it's like wisdom gained from being in the trenches.
Exactly. They help guide healthcare professionals
Okay.
in making the best decisions for their patients.
That's a great way to describe them.
Yeah, they're like little nuggets of wisdom.
Little nuggets of wisdom, I like that.
That can make a real difference in patient care.
Okay, so in the case of dengue,
Mm-hmm.
what are some of the most valuable clinical pearls?
Well, one of the most important is recognizing that dengue can be very dynamic
Dynamic.
and unpredictable.
Unpredictable in what way?
A patient's condition can change quickly.
Oh, I see.
So close monitoring is essential.
Close monitoring, okay.
We can't just rely on a single set of vitals.
Right, you need to keep checking back.
Exactly. And this monitoring should include hematocrit levels.
Hematocrit levels.
So
Okay.
remember those.
Yeah, we talked about them earlier.
They can provide valuable insights into the severity of the infection.
Okay, so why are they so important in the context of dengue?
Well, as plasma leaks out of the blood vessels,
Right, that plasma leakage.
the concentration of red blood cells in the remaining blood increases,
Okay.
leading to a rise in hematocrit levels.
So rising hematocrit level is like a warning sign.
Exactly. It indicates that the patient might be at risk for complications.
Okay, so it's something to watch closely.
Definitely. It can help guide treatment decisions.
Another clinical pearl is addressing those misconceptions about dengue treatment,
Right. Those misconceptions can be harmful.
like the one about antibiotics being effective,
Exactly. It's crucial to dispel those myths.
and make sure healthcare providers are following the evidence.
Absolutely. Evidence-based practices are essential.
So, for example,
Yeah.
platelet transfusions are rarely necessary.
Right. They should only be used in very specific cases
So it's about using resources wisely.
and making sure every intervention is truly beneficial.
I think those clinical pearls offer some great insights
They do.
for healthcare professionals
It's all about staying informed.
and up to date on the latest research.
Absolutely. That's how we improve patient care.
But it's not just healthcare professionals who have a role to play, right?
Right. It's a collective effort.
Everyone has a part in the fight against dengue.
Exactly. It's about community involvement.
What are some ways individuals can contribute?
Well, we talked about eliminating mosquito breeding sites around homes.
Yeah, those simple things can make a big difference.
They can, and it goes beyond our own homes.
Oh,
We need to be aware of potential breeding sites in our communities.
like what?
Parks, abandoned lots, construction sites,
Oh, I see.
and take action to address them.
Like reporting a problem to the city.
Exactly, or organizing a neighborhood cleanup
So it's about being proactive
and taking ownership of our community's health.
and spreading awareness, right?
Absolutely. Talk to your friends and family about dengue.
Okay.
Share information about prevention strategies.
Right.
Encourage them to take precautions when traveling.
To areas where dengue is prevalent.
Exactly. Knowledge is power.
I love that. Knowledge is power.
The more we know about dengue,
Yeah.
the better equipped we are to fight it.
We're not powerless against this threat.
That's right. We can make a difference.
Well, we've covered a lot in this deep dive.
We have.
The dengue virus, diagnosis, treatment, prevention, research.
It's been a thorough exploration.
It's been a truly insightful journey.
I've enjoyed it.
I'm so grateful for your expertise.
You're welcome.
As we wrap up this episode,
Okay.
I want to leave our listener with one final thought.
One final thought.
We've talked about the seriousness of dengue,
Yeah.
the challenges it presents,
Uh-huh.
the global effort required to combat it.
It's a big problem.
But amidst all of that,
Yeah.
there's a glimmer of hope.
A glimmer of hope? I like that.
Researchers are making incredible strides
They are.
in developing new vaccines, treatments, and control strategies.
Every day we get closer to a solution.
And with each breakthrough,
Yeah,
we move closer to a future where dengue is no longer a threat.
that's the goal.
It's a reminder that even in the face of complex challenges,
Right.
human ingenuity and collaboration
Yeah,
can pave the way for a brighter future.
it's a powerful message of hope.
And that's what makes this deep dive so rewarding.
Rewarding. How so?
Exploring the frontiers of knowledge
Okay.
and discovering the potential for positive change.
I agree. It's inspiring.
We hope you've enjoyed this journey with us.
Thanks for listening.
Until next time, stay curious, stay informed, and stay healthy.
So one of the most valuable pearls is recognizing that dengue,
Yeah,
it can be a very dynamic disease
dynamic, okay.
and unpredictable.
Unpredictable, okay.
The patient's condition can change rapidly.
So you really have to stay on top of it.
Exactly. Close monitoring is essential.
Close monitoring, okay.
You can't just rely on a single set of vitals.
Okay, so regular checkups.
Right. And this monitoring should include those hematocrit levels.
Hematocrit levels again, okay.
Remember those?
I do, we talked about them.
They can provide valuable insights
Uh-huh.
into the severity of the infection.
Right. So remind me again why those hematocrit levels are so important with dengue.
Well, remember when the plasma leaks out of the blood vessels?
Yeah, that plasma leakage.
The concentration of red blood cells in the blood increases,
Okay.
leading to a rise in those hematocrit levels.
So it's like a domino effect. The
Yep.
leakage causes the hematocrit levels to go up
Exactly. And that can be an early warning sign.
of more severe dengue.
Exactly.
Okay, so it's definitely something to keep an eye on.
Absolutely. It can really help guide those treatment decisions.
Another clinical pearl
Yeah.
is addressing those misconceptions about dengue treatment,
Right. Those misconceptions can be dangerous.
like the one about antibiotics.
Exactly. Antibiotics don't work against viruses.
They only work on bacteria.
Right. So it's crucial to clear up those myths.
And make sure healthcare providers are following the evidence.
Absolutely. Evidence-based medicine is so important.
Okay, so no antibiotics for dengue.
Definitely not.
And we talked about how platelet transfusions are rarely necessary.
Right. They're only needed in very specific cases.
So it's all about using resources wisely.
And making sure every intervention is truly beneficial.
It's about doing what's best for the patient.
Absolutely. That's always the priority.
I think these clinical pearls are incredibly valuable,
They are.
especially for healthcare professionals,
It's all about staying informed and up to date.
on the latest research and best practices.
Exactly. That's how we improve patient care.
But it's not just healthcare professionals who have a role to play.
Right. Everyone can contribute.
Everyone has a part in this fight against dengue.
It's a community effort.
So what can individuals do to help?
Well, we talked about eliminating those mosquito breeding sites.
Around our homes.
Yeah, even those simple things can make a big difference.
And it goes beyond our own homes, right?
It does.
We need to be aware of potential breeding sites in our communities.
Exactly, like parks, abandoned lots, construction sites.
So many places.
Right, and we need to take action to address them.
Like reporting a problem.
Right, or organizing a cleanup
It's about being proactive.
and taking responsibility for our community's health.
It's about working together.
Exactly, we're all in this together.
And spreading awareness is important too, right?
Absolutely, talk to your friends and family. Share information about dengue and how to prevent it.
Right, education is key.
It is. Knowledge is power.
I love that knowledge is power.
The more we know about dengue, the better equipped we are to fight it.
We're not powerless against this threat.
Definitely not. We can all make a difference.
Well, we've covered a lot of ground in this deep dive.
We have.
The dengue virus.
Yeah.
Diagnosis, treatment, prevention, research.
A lot of information.
It's been a truly eye-opening journey.
I agree.
I'm so grateful for your expertise
You're welcome.
and your insights.
My pleasure.
As we wrap up, I want to leave our listener with one final thought.
One final thought.
We've talked about how serious dengue is,
Mm-hmm.
the challenges it presents,
Right.
the global effort required to combat it.
It's a big problem.
But amidst all of that,
Yeah.
there's hope.
Hope. I like that.
Researchers are making incredible progress
They are.
in developing new vaccines and treatments.
New strategies for control.
And with every breakthrough, we get closer to a future where dengue is no longer a threat.
A future without dengue?
It's a reminder that even in the face of complex challenges,
Right.
human ingenuity
Yeah.
and collaboration
Absolutely.
can pave the way for a brighter future.
It's a powerful message.
It really is, and it's what makes these deep dives so rewarding.
Rewarding? How so?
Exploring the frontiers of knowledge.
Okay.
And discovering the potential for positive change.
It's inspiring.
It is. We hope you've enjoyed this journey with us.
Thanks for listening.
Until next time, stay curious.
Stay informed.
And stay healthy.